When I actually started at Molina Healthcare, I started as a transition of care coach. And really, the transition of care coach is responsible for outreaching our members who are in the hospital and try to help them to be stabilized once they reach the community. My role was unique because I was in the hospital to visit the members, so I was frequently face-to-face with them. And the biggest need that came up all the time was housing insecurity. So either they did not have a place to return to, or the place they were going to return to was not one that would help them with their health outcomes. When Molina started the housing program, I was excited to see that we were addressing that huge need. And so I just tried to make sure that I was connecting our members to our housing specialists. And as I've changed roles, my fire for it has grown, because I've seen that it wasn't just, in a vacuum, just me dealing with that. It was a lot more members dealing with that, and not just in my area, which was Chicago at the time, but the whole state. We use our housing specialists to outreach our members to, assess what needs they have. And then, she's looking to support them with, housing resources that are relevant to each individual member. We don't do a cookie cutter approach. We really want to make sure that the resources that we're giving are for that particular member. We also have our community connector specialists who help out for any of those other SDOH needs, whether that's clothing, whether that's food, things like that, transportation. And so we're making sure that if we're finding out about any, social determinant of health need, that we are addressing those with our members. We've seen that we've had over 900 internal referrals, housing consultations, what we call them. Those are weekly. We've had over 900 of those over the years. We've had over 300 applications that we've completed for our members to get them on the housing list that they qualify for, to help out on that end. And then we've had almost 90 members that we've been able to confirm as having been able to be approved for housing and be able to move in to a place that was affordable and safe for them.